sir. Thank you for joining us.
Oh, thank you. I heard you over there. I'm looking up there. Senator, how are you? Thank you. And I'm sure that those crises have nothing to do with us.
No, right.
We just happen to be here at this time. I want to thank you, Senator Croce, for putting this forum together. Our senators who are working so hard on this issue from around the state. We thank the state for their support and leadership, and all of my colleagues here. Of course, locally, Senator Phil Boyle, who's been a great leader on this issue as well, and Senator Venditto, and of course, the Dean of our delegation here, Senator Laval. This is a critical issue for us, as you know, in the county, as it is across the country. I have with us here who will be following me to offer testimony a little more specific. Our Commissioner of the Department of Health, Jim Tamarkin, Dr. Jim Tamarkin, as well as the Suffolk County Police Commissioner, who will talk about the issue from a law enforcement end. But this is an issue that, of course, as you know, has gripped our nation and is something that is a scourge in our own county. In order to combat the rising trend of opioid addiction here, we know, and I think this is a great sign of it, we all have to come together to work to combat it. My administration and the Suffolk County Police Department have launched a multi-pronged approach to addressing this critical issue. Continuing of programs that have licensed health professionals, emergency service personnel, as well as the public with training. And this is something we really took the lead on here in Suffolk County, and my colleagues here have really done a great job with, and that is administering the overdose reversal drug Narcan and providing that training. Since we started this program, we've trained over 4,000 people here in Suffolk County. That's a program that we want to expand even further. Thank you. Introducing new public awareness, we think that is just vitally important. I think the mayor spoke well about this. Intervention and peer-to-peer programs in the Rocky Point and Sachem School District. We need to really be implementing best practice, evidence-based prevention programs. Those are critically important to combating this epidemic. Most recently, our Suffolk County Health Commissioner reached out to the CEOs of our local hospitals, recommending that Narcan be distributed to appropriate patients and families in the emergency department and inpatient setting upon discharge. We're pleased that we have received really a great response to that request and look forward to the implementation of that program. Also implementing the Vivitrol program, that assists soon-to-be-released inmates in overcoming addiction to reduce recidivism. So we've introduced that program working with Sheriff Vinnie DeMarco and Commissioner Sini, introducing that program, and we are very hopeful about the success of that effort that we engaged in and we started last year. Just this past April 1st, we implemented a 24-hour-a-day, 7-day-a-week substance abuse hotline with our community partner, an organization that is really a leader here, LICAD, which you're all familiar with and work with, which will link callers to appropriate treatment. All the callers are screened by a certified medical professional and referred to a local provider. This hotline is available to those in crisis, contemplating treatment, and to support friends and family of those suffering from an addiction. LICAD will also provide follow-up to ensure timely access to care. So this started on April 1st, and we're very excited about that. Collaborating with Stony Brook Medical Center, the Nassau County Department of Health, and local substance abuse and prenatal providers, we've collaborated with them to address the rising trend of babies addicted to drugs in Suffolk and Nassau counties. We've increased staffing at the county's 4 methadone clinics, specifically to address callback lists, and are increasing the availability of intake appointments. In 2015, we had an increase in enrollment of 26%. And in the first 3 months of 2016, we've admitted 50 persons. And finally, passing regulations for pawn shop operators that protect victims while working to reduce crime stemming from heroin and opioid addiction. This is an effort that was spearheaded by Commissioner Sini, which I know he'll refer to. And so, as this is an epidemic that is affecting all of us in this county, in this state, in this country, it is something that we are looking forward to with this hearing and with the state's leadership of really making progress here by working together. And that's why I'm so happy that you're doing this today, and that this issue is on the forefront, I know, in the state Senate. And, I've worked with a number of my colleagues here on this issue and have been doing great work. And I would finally say, of all the approaches that we are taking in this comprehensive approach, which is what we need to do, prevention truly is, I think, the greatest area that we can exploit to make progress on this issue. I think it's the most cost-effective thing that we can do, and it's probably the thing that we're doing least. So I'd love the opportunity to work with the state on enhancing some of those prevention programs, specifically evidence-based prevention programs that we know work. So thank you very much.
Thank you. Thank you, County Executive Ballone. Thank you for using the bully pulpit so effectively. Next, we're going to have some of the county team give us their testimony. Start with Police Commissioner Tim Sini.
Thank you very much for providing the county the opportunity to speak before this task force. The heroin and opioid epidemic in Suffolk County, from a law enforcement perspective as well as a public health perspective, is our #1 issue. About half of our crime in Suffolk County is some way related to the opioid epidemic. We have approximately 2,000 arrests in 2014, 2015 that directly relate to heroin drug dealing. But when you consider the burglaries, larcenies, robberies, and other violence and property crime in the county, it is very safe to say that over 50% of our crime in Suffolk County is related to the heroin and opioid epidemic. We need to obviously be addressing this issue on all fronts: prevention, treatment, and law enforcement. I'm going to talk about prevention from the police department's perspective as well as law enforcement, obviously. I couldn't agree with County Executive Ballone more that our best investment is in prevention. The Suffolk County Police Department has launched a program called the Ugly Truth Forum, and I know many of you know about it because I've seen you at these events. It's typically a partnership with a community coalition group and a school district where we raise awareness and educate parents and children about the dangers of opioid addiction and opioid abuse. And typically treatment providers set up tables at these events so as to provide resources to parents and families and children. In addition, we typically do Narcan training at these events. So these are great events that we're going to continue to do with all willing school districts, and we've hit just about all school districts in Suffolk County, and we'll continue to do that. We also have a robust community response bureau, which includes school resource officers, and these school resource officers are police officers who are assigned to districts, and they are essentially cops in schools, and they develop relationships with students, and it's a great program that I've received tremendous feedback from superintendents and principals and educators on. And this is a program where, in my view, we need to expand. We don't have enough SROs to put in every building, and I'm not saying that we should, because that would be a tremendous cost. But we should have enough SROs to at least assign to each district, or at least 1, 2, 3 districts. And we're spread very thin, and I can provide a list of all of our SROs to you and where they're assigned, so you could see it for yourselves. So that's one area where I think we can increase prevention work. I think the SROs have a laundry list of programs that they do, many of which are evidence-based, and some of which are developed by the police department, whether it's education about proper usage of social media and the dangers of social media, or drug abuse and healthy decision making. And I think expanding the SRO program would be a terrific way to increase prevention in Suffolk County by the Suffolk County Police Department. On the enforcement end, we've really revamped our approach since December of 2015. When I came in, we did a top-to-bottom assessment of our narcotics enforcement, and we were very centralized. We have a narcotics section that's out of headquarters, and we were funneling most of our narcotics issues into the narcotics section. What we've done since is we've pushed a lot of that back down to the precincts, and this has allowed us to increase enforcement. So I just want to walk through the 3 prongs of our enhanced narcotics strategy since December. We've re-engaged our federal law enforcement partners, particularly the Drug Enforcement Administration. So we now have 5 full-time detectives assigned to DEA task force, most of whom are essentially working exclusively on the opioid heroin epidemic, and one of whom is working on going after bad pharmacies and doctors for the illegal prescription or illegal distribution of opioids. So we have a robust relationship now with the federal law enforcement agencies in the region. And this is key not only for the obvious reason that we're working with the feds to bring down drug dealers and bad doctors and pharmacists, but it allows now the Suffolk County Police Department, it allows our patrol and our detectives division to focus more on some of the local issues that I'm sure so many of you have heard complaints from your constituents about. So what we've done now is, because we have some more, since we've leveraged these relationships, we've dramatically increased our focus on residences where drug dealing is occurring. We've recently rolled out a hotline, 631-852-NARC, where we're accepting calls from the community. You can remain anonymous. And what we do is we take those calls in and we funnel them through our criminal intelligence section. The criminal intelligence section then assigns it to the appropriate precinct, or if it's a big enough issue, to the narcotics section. Since we've rolled out this program, not the hotline, that's very new, but since we rolled out this new structure, we've increased our search warrants dramatically. We've now executed approximately 50 narcotic search warrants year to date, which is an increase from last year and the year prior. And in every single search warrant, we have recovered drugs. All in all, it's kilogram quantities of narcotics. And what's scary about it, in all but I think 2 of these search warrants, we've recovered some sort of weapon, including firearms. So we're going to be focusing on homes and apartments where drug dealing is occurring, and we have this new structure in place and this new hotline to assist us in that. And then lastly, we stood up a Long Island Heroin Task Force, and this is an unprecedented partnership between Suffolk County and Nassau County. Initially, we designated 4 detectives and a supervisor, and Nassau did the same. And the idea was to go after drug dealers who cause overdoses. And there are statutes on the book under the federal laws where there are enhanced penalties when you cause death by dealing drugs. It's a 20-year mandatory minimum, maximum of life. And we're working with our local district attorney's office as well to bring these cases down. And what happened was DEA then jumped on board, New York State Police jumped on board. So now it's a real robust partnership among all these law enforcement agencies, exclusively going after drug dealers who cause deaths. I also think this is a great area where law enforcement can interface with public health, because usually our informant in that situation is someone who is saved by Narcan, or unfortunately a family member of someone who died. And we get the phone from the family member or from the individual saved, and that's how we go after some of these bad guys. And so we're interfacing with people who have just died and been brought back to life, or family members who just lost someone. And this is, I think, an opportunity where we can get people into treatment, whether through the use of LICAT or Department of Health or whatever agency we want to use. And so we're trying to have this multifaceted approach, leveraging our resources with the feds so that we can go after the big drug dealers, and allowing the police department to do just an increased number of enforcement cases within the police district, and then also going after what we consider the ultimate harm that these drug dealers cause, which is death, through the Long Island Heroin Task Force. At the end of the day, resources are stretched thin, as I know all of you know, and we need to find creative ways to use our existing resources in the most effective way. We've launched several efficiency programs within the department recently, including some efforts to reduce paperwork for patrol officers. They can engage in evidence-based policing and real police work, so they can focus in on problem houses and do hotspot policing instead of doing paperwork. But at the end of the day, we do need more resources. So I would just float that any way that the federal government or the state government or together could help the county in terms of whether expanding our SRO program to get more officers in the schools to do prevention work, or allowing us to leverage some federal state grants to increase the number of detectives and patrol officers to do enforcement action. I think that would be terrific. And with that, I would take any questions.
Senator Boyle?
Thank you, Commissioner. Thank you for your leadership on this. One question you did mention, and I applaud you for your three-pronged approach, the 852 number, the telephone number. We, as elected officials, and I know from particularly with my background on this, get a lot of phone calls from a lot of people saying, we know that there's drug dealers in this house. Give them the address. Sometimes we get 4 or 5 calls about the same house. So we'd like to partner with you and set up a communication where we can tell we're getting a lot of calls on this. I know they might be calling this number, but they're calling our office, and we want to contact you.
Yes, absolutely. And I think, to be very frank with you, I think in the past, the way the department was set up in handling some of these complaints is they were bottlenecking in our narcotics section. So what I'm hoping, and it's already proving to be true, is that by pushing some of this back down to the precinct level, that bottlenecking will stop and we'll be able to address the concerns more appropriately.
Great. Thank you.
Thank you, Commissioner. Senator Murphy?
Commissioner, I applaud your efforts in a tremendous way. What we've tried to do is start a northern initiative with the feds, so you can, because we're just north of the Bronx, and having that coalition together between the feds, the state, the county government, and your local municipalities. Forget about the turf wars. This is my place. That's over. When we work together as a team, like you said, you're going to make a difference. And we've made a difference to the little northern initiative that we put together. 14 kilos. It was in the Bronx, but we're just right on the border right there. And I saw it all coming right into Westchester County and right up into Putnam County and right up the train. They literally go on the train and sell it on the train and coming up. So I applaud your efforts. Keep up the great work.
Thank you. And just to make a point about the 14 kilos, some of that is destined to all of our communities, and that's exactly why we all need to be working together.
I know recently, Commissioner, in one of the school districts in my Senate district, they found a young man, Eagle Scout, good family, in possession of a large quantity of heroin in school, and I want to express to the community and to you some of the challenges we face as a conference. We recently passed in the New York State Senate a bill that would make the possession and intent to sell heroin to minors around schools. We sought to increase the penalties, and it did pass the Senate. But there were members of our body who stood up and said because of the job market, he couldn't vote for that, because those people need jobs too, meaning the drug dealers. And so I just want you to know, So from our perspective, everyone in this room, we all assume that we're all there to do the right things, and we're all there to give you the tools that you need to do your job at the local level. But it's not uniform, and it's certainly a challenge for us sometimes, and listen, everybody has, I believe, the best interests of their constituents at heart who serve, but there are certain common sense things that can get lost in this discussion. I want you to know that we will continue to advocate for tougher penalties, but at the same time, that prevention approach, early primary prevention education, has always been proven to reduce the demand signature so that those guys are out of work. And that's what we're looking to do. So I appreciate your hard work and that of all the men and women of the Suffolk County Police Department and all the law enforcement that you represent. Thank you.
Thank you very much.
Yes.
That was not a member of the Republican Senate Conference that made that statement about the jobs.
Thank you, Senator O'Mara. That is correct. Commissioner James Tamarkin is with us as well. Commissioner, we're happy to have you, sir.
Thank you for the opportunity to speak to you and present some information that I think will be helpful. As a background, just so you know who I am, in the 1980s, I was the clinical director of the largest substance abuse treatment program in Canada. Was a consultant for the Canadian federal government as well as the U.S. federal government on substance abuse and methadone specifically. I've also worked in managed care for 3 years, 3+ years, so I have an insight into how managed care works. And what I want to focus on today is access to care for those that are afflicted with substance abuse. I think we all need to appreciate that this is a very unstable population. They have very chaotic lives. You can't deal with them the same way you can with a patient who has a different kind of medical condition, of high blood pressure, diabetes. You can't say to them, come back in 2 weeks, 3 weeks, whatever. It just doesn't work. They have to be engaged as soon as you can interact with them. And what we need is quick decisions, and we need decisions that take into account the chaos in their lives. So people may not need hospitalization from the point of view of their substance abuse problem, but they may not have a safe place to live, and therefore go back to an environment that causes them to continue to use. They still associate with the wrong people, they live in the wrong area, and so their problem continues to be exacerbated. In terms of managed care organizations, my concern, and this is from my own experience, is that the decisions that are made within managed care organizations are made by employees of that organization or contract employees, and that the appeals are often made by those same people implementing the same policy that they've been told to implement in the first place. Now, if that isn't the fox guarding the henhouse, I'm not sure what is. I think you could legislate action that provided for an independent, third-party, objective review of the case immediately, not a week later, not 2 weeks later, not 3 weeks later, but immediately, and who are not employees or not associated with the managed care organization. The other issue that I think managed care needs to be held accountable for is continuity of care. So they have a person, they treat them inpatient, outpatient, they discharge them and say, here's an appointment for 2 weeks or a week or whatever. We all know that the odds of that appointment being kept are very small, if at all. They should be held accountable to follow up, to make sure that the patient receives whatever follow-up care and treatment they need. They can't just cut people off as soon as they walk out the door. The other initiative, and this would be part of a quality improvement initiative, would be to have a database that all overdoses and all deaths that come to the attention of the healthcare system be reported to the state, and an investigation be done to see if care was denied to these individuals. So those, I think, are a few very practical and hopefully substantive approaches that you could take to help us get some teeth into our programs and to make sure that these people do not fall through the cracks, which is what's happening, and that the recidivism rate decreases because we have a comprehensive care that does not allow them to fall through the cracks. Thank you.
Thank you, Doctor. Questions for the doctor? Thank you very much. We also have, I believe, Suffolk County Police Department investigator Michael Caldarelli here. Is he here? No? Okay. I think the commissioner can handle that one. The next individual, and this is something, again, someone who sees this and represents residents who see it on a daily basis on the ground, and that's Ronkonkoma Civic Association President Bruce Edwards.
Thank you, gentlemen. The Ronkonkoma Civic Association is very pleased to be here, and thank you very much, Senators, for putting this together. The Ronkonkoma area is fortunate that we share two senators, both Senator Boyle and Croce. So
we fight over you, actually.
Oh, well, it's very heartening to see that our area is very well represented, especially in this area. In the heroin situation, from a community level, we see it as drug houses, needles in the street, quality of life issues that really affect the residents of our area. And so we feel that enforcement is a very important aspect of it. And we're very happy that the Commissioner Cindy, has gone back to a community level. He's asking us, and he's reached out to us actually, to become involved in this, become involved in the programs, let him know what's happening in our streets. So we hope that that works, and it's important. I think that we get more funding, and if this proves to be successful, that we keep funding those issues so the police department can do the proper job for the residents. One of the other areas, of course, is treatment. We see that treatment is very important to people. It seems to be, as you've heard from the various experts here, that treatment is lacking. And I read in the paper that there's wait lists for methadone clinics, and that's just it's just unconscionable. So we really feel that treatment should be improved as much as possible. Again, it comes from funding. You guys are going to be the ones who really allow this to happen. And like the third leg of the tripod is education. And again, another unfunded mandate from the state to educate elementary school children and junior high kids just isn't going to work. We really need the money to come to the top, from the top, to fund these programs. We really need to educate these kids at a very young level, elementary school and above. I know my children are a little older. They went through the DARE program. Some people said that it wasn't a successful program, but fortunately for me, my children managed to get through this unscathed, and I'm unbelievably thankful for that. So I would just hope again that you guys will do the best you can to fund these three different areas that seem to be the areas that will maybe stem this horrible program, this horrible epidemic that's across our almost nation. So thank you again, gentlemen.
Thank you very much. Next, I have Miss Mary Calamia, licensed clinical social worker.
Hi, good afternoon, and thank you for having me here. Yes, I am a licensed clinical social worker and a KSAC for 21 years. I also hold the title of crime victim and the bereaved, so this addiction problem has touched me in many, many ways. I started out, at the time it was the crack epidemic, and now we have the heroin epidemic, and the dynamics haven't really changed. And maybe the ages have gotten younger, the drugs have changed, but the dynamics remain the same. So we need to think outside the box. And we need to hit on a few things that I'm not hearing spoken about. I'm going to try and touch on some things that people aren't speaking about here. One is an area that's very near and dear to me. I work with a lot of family members. And we have family education, and we have programs where we're getting some of the families in and educating them on addiction. But they need therapy. And if you want to talk to the insurance agents, the insurance companies, and I don't want to get into the weeds here, you can't do family therapy without a diagnosis. And a diagnosis of my child is an addict or I'm living with an addict, that's not a diagnosis. It's not an insurance reimbursable problem. So we need to be able to get some money out there for programs for these family members, because every addict, what keeps addiction alive is a system of enablers, right? And well-intentioned loved ones who end up getting the opposite results than what they're trying to get. So we need to be able to get into these families. I'm sorry, did you?
No, okay. Not at all. I'm agreeing with you.
Okay.
We're in violent agreement.
Thank you. Also, I noticed there's a S4348 on the table. It's, I think, Kemp Hannon sponsored, and it's to get training or addiction information to doctors who are prescribing opiates. And I think that's great, but I noticed there are exemptions in that requirement. And we got to throw those exemptions out. Every physician, every qualified health professional should have a training in addictions and the family dynamics of addiction. I go to my chiropractor. First of all, under the ACA, all doctors are supposed to be screening for mental health and substance abuse. They're given screening tools, but they don't know what to do after that. I go to my chiropractor, and I get a form that asks me, has anybody asked you, said you have a problem with drinking? Have you ever used an illicit substance? Do you want to hurt yourself? I go into his office with the sheet, and I say, what are you going to do if somebody answers any of these questions in the affirmative? And he says, I don't know. So we need to get the tools to every qualified health professional. I don't care if it's an eye doctor. They're seeing people who have addiction problems or are living with family addiction problems. So we got to throw those exemptions out the window. Everybody, unless you have a KSAC, you haven't had the training. I'm willing to volunteer my time to help create curriculums for all of these things. But that brings me to my next issue, which is private practitioners like myself, we're left out of the loop. I'm not attached to an agency or an organization, so when there are new programs or new initiatives, I don't get that information. But NYSenate and the Office of the Professions has my email address because we have to renew online our licenses. It's an email, an opt-in. We need to know what new programs are out there. We need to know where to refer people. And as a clinical social worker who got their license, I don't know, a long time ago. I'm getting old now. And I'm getting tired. It enraged me at the time I went to school. There is no requirement for a social worker to take any training in substance abuse. Yet we're out there in the trenches with substance abusers no matter where we are working. So we need something along those lines as well. Again, I'm happy to, I don't want to get into the weeds and I don't want to take up too much time with details, but I'm happy to talk to any of you on these issues at a later date. And the last thing, not one taxpayer dollar should go into a sober home that isn't licensed, inspected, regulated, audited, the whole nine. Every addict needs a place to stay in their recovery. Recovery, as somebody said, I think Mary Kate Mullins said earlier, 18 months before you even start to get your marbles back. Thank you for your time.
Thank you. So I made the mistake of skipping over some of our most important witnesses today, and they'll be speaking next. I have Ms. Karen Hemmendinger, Dory Schofield, Josephine Giangarelli, and they're all here to provide us with a testimony having experienced firsthand the devastation in their families from this epidemic. Ladies?
Hi, I'm Dory Schofield. I want to thank you, Senators, for having us here as testimonials to what we have been through. My name is Dory Schofield. Most people know me as the Long Island animal rescuer and animal advocate. On June 23rd, 2011, the devil took my son, and the devil is heroin. I came home from running to the store, went upstairs to see what Danny was doing. He had just gone to work. My son had a great union job. He was what I thought was doing really well. And I found him on the bathroom floor, lifeless. I called 911. I did CPR. We had no Narcan. And the thought that Narcan could have saved my son and he could still be here will haunt me forever. But I'm so grateful that we have it now. No matter how many times we have to revive someone, where there's life, there's hope. Yeah. I think heroin is the best form of terrorism in our country. It is killing our kids by the hundreds. When we had an Ebola death, one death, whatever it was pandemonium. 400 kids in 1 year in New York State die of a heroin overdose. And we're all sitting here trying to figure out what to do about it. After my son passed away, I started a foundation in his memory, Dan's Foundation for Recovery. And I help kids who want help. And let me tell you something. If there's an animal in need anywhere on Long Island, I will have that dog or cat safe in a medical facility and taken care of by the end of the day. This past Monday, I spent an entire 8 a.m. to 5 p.m. trying to get one kid who wanted help into a facility. And I, by the grace of God, was successful, but it is just so hard. I have kids that call me and they're ready to go. I want help. Okay, well, are you withdrawing? No, I'm not. I'm not withdrawing. All right. Well, I have to sit there and make them drink a beer before I can get them into a rehab facility. Because if you have alcohol in you, they'll have to take you in. And it's just insane. When I get these calls, I feel so defeated already and frustrated because I can't get them the help they want now. When a kid says, I want help, if my son said, I want help, I would want somebody to say, Danny, I'm going to help you now. We're going. Let's go. And I did try to do that with my son, and I drove around all night one night and got nowhere. And here I am today very frustrated because these kids, when they say, Dory, I want help, I need help, I want them to get it now before they're dead. Because in 3 hours from now, they're going to go use and they're going to die. So thank you for having us and listening to our plight.
Thank you, Dory.
Hi, my name is Karen Ellar, and I lost my daughter Samantha, 23 years old, January 20th, 2013. Her killer, she died of a heroin overdose. Her boyfriend at the time is a professional drug dealer. He has 29 arrests in Suffolk and Nassau County. He has just recently arrested again within a year ago and already out on the street. New York State has very severe laws for drunk driving. I think the laws should be more punishable to the dealers. He's walking the street and somebody else is at risk of dying. But also awareness. I agree with the elementary school, hands off heroin, and the sober houses and the mental health. It should be dual recoveries with mental health issues as well as heroin. And a lot of them don't have that. And that's it. Thank you for the opportunity to hear us.
Thank you.
Thank you. I speak as a mom who lost her son. This is the face of someone who had troubles with this addiction. Once this hits their body, they change. They're a mere shell of who they are. You don't know who they are anymore. They don't know who they are anymore. My son passed 6.5 years ago. This is an actor. This is a singer. This is a person who is in his community, who loved children, who was a good person. From what I see, this is 6.5 years ago. There was not Narcan. I wish there was. There was nothing. I begged everyone. I'm very active in the community and know many, many people. And this is something that affected him, and we did not know where to turn. On every aspect, the police department, calling them, and we do need education in every area. This is a good kid. This is a child who comes from parents who love him and adore him, and there is not addiction in the family. Not that that matters, but people need to be educated that these are good people, that these are individuals who are loving and caring and contribute. And the education that is out there, only too often people are turning their heads because they say, not me, no, not me, no, not my family. Well, it does happen in so many families that they have no idea of what is going on. I do the James Garinghelli Memorial Scholarship Fund at the high school that he went to every year. I sat down with the music director yesterday, and I said to her, what can I do? How can I, how are these kids doing? This was a big part of James's world, and I felt that this is something that would bring the goodness, a goal for a child to achieve. But she said, well, you know, Josephine, I'm not exactly sure how, but the kids, they don't understand the concept that they could die from this. They are getting people, these dealers who come everywhere, to the school, to the house, everywhere. When my son was in a so-called safe house, he called me and said, Mom, there are more drugs here than you can imagine. Everything from everywhere. You have to get me out of here. So people need to know what is really happening out there. We need from the top all the way to the parents to understand and care about our children. They are dying every day. Every day our boys and girls are leaving this world. And we need to do something about it. Somebody needs to listen. Somebody needs to hear about these children who are good kids. I thank you very much.
Thank you very much. Senator Murphy.
Ladies, before you leave, first of all, thank you so much for being courageous and telling your stories up here today. But I'd just like to let you know, up until last year, it was illegal for school nurses to administer the life-saving antidote Narcan on school premises. See my colleagues up here? They fought tooth and nail to get it in our one House bill. You have these guys to thank. Also, we made sure all first responders, up until last year, it wasn't mandatory that they have the Narcan kits. But we're not big fans of unfunded mandates. We funded it like someone others is. Just because we come down over the top, we actually funded it and did the right thing. So to your point about the Narcan, it is the life-saving antidote. We get it, and we're trying to get it out there. But I just want to say thank you for being courageous and coming up here today.
We have one other, Senator Phil Boyle.
Yes, just very quickly, I too would like to thank these ladies for coming to testify, and to know that your personal tragedies have been turned into something positive. And you know, through your advocacy, what you've done over the years, and of course, Karen with Samantha, your daughter, Stevie worked in our office, your other daughter and Samantha's sister. That started the whole thing. Stevie lost your sister. She told me, I went to the leader of the state Senate, and we started the first task force. And since then, there's been 25 hearings, countless hours of testimony, but it all started with Samantha.
I just want to say one last thing. When I've been listening and hearing on the news about the Narcan, I'm so appreciative for that. They do grab hold of the Narcan. I'm hearing so much more of the effects once the addict gets the Narcan, rather than the wonderful effects that it does. So we really need to elaborate on that. They do need this. This saves their lives. Thank you.